Okay, so Michael Chernew, it's great to talk to you, and thanks for agreeing to come on the blog with me.
Thanks for having me.
I have to show, for the purpose of our viewers, a memento. Now, why is this Mountain Dew a significant memento?
Yeah, I used to drink a lot of Mountain Dew. It was never diet.
That is true. That is true. Before we introduce each other, I should say that not every day, but almost every day at 10 o'clock at the University of Michigan, we would wander over and down many gallons of such things
Right.
and discuss the great issues of the day.
Aging gets you off the Mountain Dew and puts you on the diet Snapple.
Well, I've got Diet Pepsi. I must say, I find Mountain Dew undrinkable. So its health impact on me would be minimal. There.
There you go. Keep it away from your kids.
So tell me about yourself.
I'm an economist. I'm a professor of healthcare policy at Harvard Medical School. I do a lot of research focused on healthcare spending growth with emphasis on what type of strategies might be employed to slow down the rate of healthcare spending growth without harming the quality of care. I'm involved in a number of policy activities. Probably the most notable is I'm vice chair of MedPAC, although everything I say today is the position of Mike Chernew, not the position of MedPAC. So it's important that I be quoted simply as me, as opposed to any organization that I represent. I've done work with the Congressional Budget Office, with the CMS. And as I
CMS
think
is
you're going to
the
talk,
organization that runs Medicare and Medicaid.
right, and I think you're going to ask about, I was honored to be a member of the Institute of Medicine's panel on essential benefits, which I can describe if you'd like.
Great, and also you're a winner of many honors, including being elected to the Institute of Medicine and various things like that. So it's an honor to speak to you.
Well, I don't have a nice blog.
That's true. I absolutely run circles around you in the
Right,
blogging
exactly.
space.
All right.
There. So what? Maybe we should start with the essential benefits. So first of all, what can you just describe what's that issue? Let's start with that.
So when you have the policy objective to increase the number of people with health insurance, you realize that in doing that, you have to define what is health insurance. I don't think we would have been particularly happy if everybody bought health insurance and they gave them $1.50 coverage for every day in the hospital. So you have to define how generous insurance has to be in order to count to be considered insurance for the purposes of making sure that everybody has insurance. And essential health benefits grows out of that need to define what insurance is. So the Affordable Care Act had in it a number of provisions that spoke about the generosity of coverage, what share of medical expenditures needed to be covered by your insurance, but they didn't say exactly what health benefits needed to be covered. And so there's been a lot of attention and focus on what is called essential health benefits, or more specifically, what benefit package has to exist in order to be considered insurance for the purposes of meeting the requirements of the Affordable Care Act.
Now let me ask you a naive question about that. So I am a progressive health policy advocate, and a lot of the people that follow my blog are as well. And so, a lot of people's gut intuition is, look, if you have cancer, insurance should cover, whatever treatments are indicated. And if you have autism, there's a, we want to get people away from the sort of nickel and diming by insurance companies and offer a really generous package. Why is it that, why shouldn't we just have something that's really pretty expansive guaranteed to everybody as part of the law?
Well, so first, I should say the law includes in it very broad categories of services that would need to be covered: hospital care, physician care, things of that nature. So there is a wide range of things that are covered. The problem, of course, is that the more that is covered in the insurance policy, the more expensive the insurance policy is, which obviously makes sense. And the more expensive the insurance policy is, because of the subsidies that are outlined in the Affordable Care Act, the more expensive the cost is to government. And of course, because individuals are having to purchase coverage as well, the more expensive the coverage is to individuals. So the question, the tension is to make sure that people have coverage that is good enough, but have coverage which is not so expensive that it's unaffordable for individuals or the government. Remember, people are not prohibited from purchasing more generous coverage. And there is some tension. The phrase essential benefits, which is what it's called, sort of suggests we want to cover only those things that are essential, and of course allow people to buy more generous coverage should they want to. But there's issues about exactly who's subsidizing what if you buy more generous coverage. So the challenge with very expansive benefits is essentially the cost of the benefits. And the challenge with defining what is essential, cancer care would be a fine example, is that we know because of the study of geographic variation in healthcare, we know because of a wide range of study in the United States, that a lot of healthcare services are used to provide minimal value to the patients, but certainly come at a cost. And we wouldn't want to devote public, or for that matter, private resources to providing care which is not improving people's health. Because healthcare is so complicated, it's very hard to know exactly which services are which, and it's further complicated by the fact that any given healthcare service may be valuable or not, depending on the patient characteristics to whom it's delivered. So a colonoscopy in a 55-year-old might be very high value. A colonoscopy in a 21-year-old might be very low value. And in many cases, the distinguishing features to determine whether something is valuable or not aren't as simple as age. They have to do with a whole range of other clinical features. So it's very hard to know what should be covered or what shouldn't be covered, and what is valuable or what isn't valuable. And therein lies the difficulty in defining what's an essential health benefit.